to the big focus we have here tonight on the urban debate. And we are going to talk about stories of horror and pain and struggle that are emerging from various parts of our country, specifically from states like Gujarat and Madhya Pradesh, that actually tell you that what the data suggests may not be the complete picture. It is also something that I asked the Uttar Pradesh minister just now. While Uttar Pradesh government clearly believes that the deaths data they have collated is the absolute truth and there is nothing wrong with it, we do have instances from Gujarat and Madhya Pradesh that for these states do paint a different picture than the official records. Gujarat, for example, has logged 64 deaths since yesterday. But if you had to take a look at the state of the crematoriums there has been a threefold increase in dead bodies recently. In a Bharuch crematorium, bodies piled up. People had to wait to carry out the last rites of their loved ones for hours. We also bring you visuals from a crematorium in Surat. This crematorium was used so much, constantly, that the metal surfaces crumbled. In the furnace, the metal that was there crumbled, melted because of overuse. The chimneys were damaged due to overheating. All because these crematoriums are now pretty much working round the clock for the past 1 week. What does it tell you? That there has been a sudden big jump in the number of people dying there. Jump that isn't reflective in the data. Here's another horrifying story from Surat. A 27-year-old young man, Pareen Shah, had to carry his 60-year-old COVID-positive mother on a handcart in the middle of the night. He alleges the local panchayat authorities refused a hearse van, didn't allow to get the body cremated at the village crematorium initially. No hearse van available. Visuals of Parin carrying the handcart went viral earlier. We even spoke to him and he narrated his ordeal. He said it was a long journey before he could finally bid the final goodbye to his mother, not in the dignified manner he would have wanted. The story is similar for many others in the city of Surat, in the city of Ahmedabad, in the city of Vadodara. From Ahmedabad, Manoj Chavda, who lost his aunt to COVID, had a harrowing time trying to cremate. First, he had to wait for hours together to get the body, and then another set of hours to get an ambulance. When that didn't happen, he arranged for a private vehicle to go to the crematorium, where another long wait ensued. These are the stories that are emerging from various parts of Gujarat, a state that still says the mortality rate is below 2%. A state that in the first wave did a mortality rate higher than the national average. But now, on records, things seem completely different. So let's go across to the panelists who are joining us on this conversation. Yamal Vyas, chief spokesman for BJP Gujarat. Ajay Umat, senior editor with Nav Gujarat Samay. Dr. Vikasben Desai, former additional director of family welfare for Government of Gujarat, former professor as well, joining us this evening. And let me actually first up go across to Ajay. Ajay, if you can give us insights, there was one analysis of data that showed that between January and 9th April, there were 100 deaths due to COVID. And then in the next 2 days, on 10th and 11th, there were 100 deaths due to COVID. But are these 50 each day also showing the reality?
No, Tanvi, I don't think that, as you were narrating the story of Uttar Pradesh, by and large, Gujarat is also following the footsteps of Uttar Pradesh, or it may be other way around. The government is collating figures. Yesterday's figure, I can tell you, my team, I am senior editor, group editor of Ahmedabad Mirror and now Gujarat Samay also. So we have collated figures of all over Gujarat. And yesterday's figure, government said that 55 people died officially, whereas the crematorium had said that they received 473 dead bodies with corona protocol PPE kits. That means that civil hospital and other municipal government hospitals had dispatched these dead bodies with corona protocol. That means that that toll should not be less than 473, where government was saying that it was only 55. And all the bureaucrats are giving only one statement that we are counting these dead bodies as per corona protocols by ICMR guidelines, which is they are telling lie from their teeth, which is visible. Today, Gujarat is running short of remdesivir. Gujarat is producing more than 40% remdesivir. We have factory, a pharmaceutical company in Ahmedabad, Cadila Zydus. Then we have a factory in Baroda, in Khambat, in Vapi, in Daman, and Gujarat is producing 40% remdesivir. But you are not seeing shortage of remdesivir in Madhya Pradesh, Maharashtra, Delhi, Punjab, or anywhere. But you are finding shortage of remdesivir, tocilizumab, Fabiflu, oxygen beds, ventilator. I'll give you another picture. Today, government said that, they have 39,250 active cases and total cases registered today is 7,410 and only 73 deaths. But on the other side, government is saying that, they have 13,142 beds. Now, if you ask 108 fellow in Ahmedabad city, you will not find a place in any civil hospital or private hospital. That means 13,142 beds are full with oxygen beds and ventilators. On the other side, more than 85% people in Gujarat, they are home quarantined. So imagine the plight. I think Gujarat is in a position to surpass the figures of Maharashtra also if you do the right number, and every second minute, we have 3 positive cases and one hospitalization at every 3 minutes. We don't have enough ventilators, we don't have enough oxygen beds. That is the harsh reality of Gujarat. And if you see just opposite civil hospital, there is an ambulance line of 50 ambulance waiting for their patients to get admission, and civil hospital has locked itself because they don't have capacity to take more patients. This is the harsh reality in Gujarat. Though government
Yes,
has
you
said
are
that from
absolutely
today
right.
6%
We
will
saw
improve.
those visuals that came from the Ahmedabad civic hospital, that entire endless line of ambulances which were there, and obviously horrific that even after that people are struggling. More and more examples, some of which you pointed out, Rajay, of people waiting for hours together to get some space to cremate their loved one's body.
Yes,
And,
yes.
and what could be worse than that? I mean, I can't imagine what can be worse than that, Mr. Yamal Vyas, where people have lost their loved ones to COVID, have waited for hours to get an ambulance, to find a spot for the cremation, and we don't even admit that they are gone because of coronavirus?
It is not a question of they are gone because of coronavirus. We have full sympathy. Obviously, everyone would have full sympathy with such cases. There's no doubt on that. But let me tell you that, as Ajay Bhai said, and as the government has constantly been saying, that ICMR guidelines are being followed, and anyone with a comorbidity which is more prevalent, may probably not be counted as a corona death. The number of deaths have gone up. I agree. There is no doubt on that. There is a shortage of lot of medicines and beds. But this queue that you are showing is because the government has streamlined the entry procedures into admission procedures into the hospitals. Now no one can go into a civil hospital or in a private vehicle. There is a proper queue, and I would like to correct Ajay Bhai when he says that the civil hospital has closed its door. It's not so. It is admitting patients right now also. But the point is that they have to come in a queue.
Wait, you are saying there is a queue to enter the hospital?
Yes, because it is all these protocols are followed and only ambulances are allowed. There is no private vehicle which is allowed. You cannot get an entry into a civil hospital without, because there were complaints of irregular entries into the government hospitals. So a lot of government has been working day and night. Let me tell you the positive side also, some.
No,
Because
but before you do that, and I will definitely give you fair time to do that, Mr. Vyas, but
Tanvi.
I am asking right now from a common man's point of view. Let's
Tanvi,
keep
just-
the technicalities aside, Mr. Vyas.
Tanvi,
I am
just
sure
1
you
minute.
know what are the indicators that are coming in from Gujarat. And
Tanvi,
1 minute, Ajay, I'm just going to put out some facts in addition to what you said. Some of them you pointed out. But these are the facts. An 8-hour-long queue at the Ahmedabad crematorium. You want to disregard the ambulance queues outside hospitals? Okay. 8-hour-long queue at the Rajkot cremation ground. Makeshift crematoriums are now being set up in Surat, in the Surat city. In old Surat, a crematorium has been opened after 15 years. For 15 years, their crematorium was not being used. And that has now been reopened. The boundary limits of crematoriums, 3 of the crematoriums in Surat, are now being expanded. The civic body of Surat has said they are bringing in additional staff to assist in last rites. We have visuals of how furnace frames and chimneys have melted. We have spoken to people about their agony and pain of hours of waiting at crematoriums. Now, Mr. Vyas, are you telling me that these people died because of their comorbidities? So if COVID wasn't there, this would have been the situation any which ways in Gujarat?
No, I will tell you, I fully agree with whatever you said. Your reporters must have spoken to people and the numbers are higher. But let me tell you a little other things also, a few other things. One, that because the crematoriums are normally made for a normal number of days, and there is electric and LPG, LNG connections for disposing of the body. Now, because that is overworked, that the other bodies are cremated by wood. So obviously that takes a lot of time. A normal body is cremated in 40 minutes in an electric or gas crematorium. Here it takes 2.5 to 3 hours. So when there is a more than average pressure on the crematorium, the lines get bigger. That's obvious. And it's not so, I mean, I agree that the numbers are very high. There's no doubt on that. But at the same time, this has happened in normal times also. If there are, at normal days, if there are a number of more bodies, then 4 or 5 hours waiting is still there in Ahmedabad. Yeah, they will endorse that. I agree. But other than that, I'll tell you that this chimney which is like melted, now you should also appreciate that the current temperature in Gujarat is more than 42 degrees centigrade during the day. Now, obviously in this heat and when the chimney, as you said, the chimney is working round the clock, there is going to be some damage. This is not made
I know, Mr. Vyas, you have to defend the government, but honestly, we can, we can just be honest about it. It's a high number of deaths, much higher because of COVID, higher than what your numbers suggest. These people are dying not because they had high sugar or high blood pressure. They are dying because they had COVID. And there is no other ways to it. Let me also bring in Dr. Desai. Good evening to you, Dr. Desai. Is there a reality that we are refusing to acknowledge about the COVID infection in the state?
So this is a new infection which has come again with a very rapid velocity. Very rapidly cases have increased. And figures may match, may not match, but there is no reason to hide the figures because that doesn't help in planning and providing services. The very reason of tracing and testing and tracing is to explore more and more cases and help them to and reduce their entry to the severe form or to the mortality. Now, if these gaps are, I'm not aware of actual figures because I'm out of system. But if the gaps are so wide, society will come to know, people will come to know that there are a large number of deaths. There is nothing to hide in it because it happens in front of their eyes. admissions happening in front of their eyes. Number of cases seen in the surrounding are in front of their eyes. So there is a rush. There is a that people are now under stress, and in that situation, and then people also understand that this is not the disease which has occurred because of somebody's fault. It is worldwide, and it has come, and we have to face it. But then when they don't feel confident about whatever is done, then it leads to little more problem and rushing here and there. So that's where the challenge lies.
No, so here is what we're trying to understand. Unless and until we acknowledge what the reality is, how will we prepare for it? Now, sudden rise, Ajay, that's happened in the cases has to be acknowledged now. If we say no, things are under control, then we will never be able to prepare ourselves for the worst. If we had seen what is happening in Kerala and Maharashtra and learned our lesson 2 months ago, we probably wouldn't have had a cricket match with spectators inside the stadium.
But we did all the...
Anyone has said things are under control. We are trying our best to provide services. That's what is the reflection which comes from the statements. And that is a reality.
No, what comes from the statements, Dr. Desai, is that we are handling the situation that so many deaths have not happened because of coronavirus. Now, if you deny the intensity and the gravity of the situation on ground, the plight of the people on ground and what they're going through and their loss, you will never be in sync with what has to be done to tackle the situation. If the argument that is being given to us is that, oh, the furnace melted because it was so hot in Surat, then we will never be on the same page as the reality. Is this hot in Surat every year?
Pressure on it. The point is there is pressure on the furnace, but this is also one of the reasons.
Why are you giving me that reason? You admit that there is pressure on the furnace because they're running 24/7 because COVID bodies are piling up.
Exactly. Tanvi, to add a point.
Right number. Today 7,400, yesterday 6,000, day before that 5,000. So we are reporting the exact number. The point is, let me also tell you, take 1 minute to give you what the government actually done. We have given 1 crore of vaccination, 1 crore number has crossed almost, and that is higher than all other states than Maharashtra. It is more than UP, it is more than Rajasthan.
You and Maharashtra got the highest number of vaccine doses. You managed to use them. What's so great about that? That is your job.
And we are half Maharashtra's population and 1/3 UP's population. So we have done a commendable job. You have to appreciate this. There is pressure. There are number of cases. This is a pandemic which has grown almost out of control. The government, the chief minister, the deputy chief minister, they are working round the clock. All the officers, doctors, they are working round the clock. And there is no one can deny, including Ajay Bhai, who has been critical. I agree that on the numbers and all. But he will also not be denying that the government and the chief minister, deputy chief minister have been doing a commendable job also.
Okay, Ajay wanted to make a couple of points. Yes, Ajay.
Now, what Yamal Bhai said, I am saying that, chief minister and deputy chief minister, they are doing commendable job. But the problem is mismanagement of some of the bureaucrat officers and that, mistakes, as Tanvi has pointed out, what Maharashtra and Kerala did. In the month of February, first week, Tanvi, we didn't have even 200 cases in all over Gujarat. Today, the harsh reality is that, Gujarat had elections in 6 big cities, 6 municipal corporations and 31 districts. So, A, there was elections. B, there was, the biggest stadium in Gujarat. That was Narendra Modi Stadium. It was full of, 1 lakh spectators. And it continued for 5 matches. And third thing, there was no control in marriages or, public functions and all these things. BJP party president in Gujarat, in Surat, had a big election rally. And day before yesterday, on one side in Ahmedabad city, there was a big queue of 1.5 kilometer to get remdesivir injections. On the other side, Surat Bharatiya Janata Party member, Surat
Yes.
BJP president had, grabbed 10,000 remdesivir injection and has distributed it in public. That means that Surat alone has a requirement of 10,000 remdesivir injections. Imagine a state which is producing more than 40% remdesivir. Why you are having shortage? That means it is nothing but mismanagement. And another thing of that figure, I would like to point out, Parsis in Gujarat, which is a minority community, and Christians, they are minority. They have changed their death crematorium protocols in Gujarat due to this, big lines. Now, this is also a very, very sad, every Parsi who loved his family member, would want that, last rites should be fulfilled as per their tradition. But they have to say goodbye. Catholic father, pastors, they came and they requested their community that children, please, today we are not in a position to follow the norms which we were doing traditionally. And third thing, Yamal Bhai, I said that, there is a queue in civil hospital, but I will give two examples. All these two persons, Yamal Bhai also know. Kelvina, a Femina, Times of India's Femina publications reporter, she told me that she is positive, her father and mother is positive, and she rang up 108 at 2 o'clock in the afternoon. And this is 8 o'clock. While I was coming to this show, she did not receive ambulance facility, and they said, madam, it will take 2 more hours. Another example, Kamal Shah, a very senior reporter in Gandhinagar, is waiting to receive remdesivir injections, and since last 7 days he is not getting injections because the government protocol says that only those who are admitted in government hospital or in corporation hospital or in private hospital in ICU, they only will get injection. Gujarat High Court has said that it is a harrowing situation, and that is the reason the Chief Justice has
and what happened? I was just going to point that out, Ajay. And what happened? The state continued to defend itself even in the High Court, where the High Court lost patience and said, don't give me these, comparisons with what the other states are doing. The situation is grim. The situation is critical in the state of Gujarat. You tell me what you're doing about it. That is what the High Court had to say. The Gujarat government even tried to blame the media for not doing its work responsibly and saying that they are misleading you with all of this information. I'm out of time, so I am going to thank all of you, but I appreciate Ajay Umar joining us with more details and facts about what's going on ground. We allowed elections to take place. We allowed cricket matches to go on with spectators in the stadium. We sat back and watched the tamasha that went on in Kerala and Maharashtra while they struggled, assuming that it will never happen to us, that for us, COVID is gone. And now we are in this state of affairs. Imagine a state that registers 100 deaths in 3 months and 10 days, and then 100 deaths in 2 days. How am I supposed to take their data at face value? How will I believe that this data is credible? Imagine a state where there is hours and hours of wait for an ambulance to get a spot in a crematorium, but says only 50 people died because of COVID in a single day. How am I to believe it? And if they can lie to me about this, if they can lie to me about whose lives are being lost and how many lives are being lost to COVID, what else are they hiding from us about the ground reality? Think about it. That's just one example. Let's give you another example. And the other example comes from Madhya Pradesh. In Madhya Pradesh, again, I will give you instances, indicators as I ask this question. Are we denying the reality, or is this mismatch because of some other problem? In Bhopal's Bhadbhada cremation ground, there was an expansion exercise that was done. The ground had to be expanded by 2 acres. In Bhopal's Jahangirabad cemetery, they have begun to dig graves in advance. They have brought in JCB machines to speed up the entire process of digging graves. Crematoriums and cemeteries are hiring additional staff to handle the load. By load, I mean the high number of bodies that are being brought in. Crematorium staff has reportedly said that the number of bodies that they are getting has gone up by 3 times. Gone up by 3 times. These are the indicators reported about the state of crematoriums and burial grounds. You know what the data, official data shows? That on April 6th, 18 deaths were recorded. On April 9, 23 deaths were recorded. Till April 11th, they were still in their 20s. It's only yesterday that 40 were recorded. What is leading to this big pileup of bodies? Does this match the statistic we are being given? And what's causing this high number of deaths? And we can only reach the third question, provided we address the first two. Dr. Surat, Head for Respiratory Medicine Department at King George Medical University in Lucknow joins us. Dr. Rakesh Pathak, Editor-in-Chief of Karamveer, with us this evening. Dr. Jyoti Bindal, former Dean and CEO of the MGM Medical College in Indore, member of the COVID Technical Advisory, joining us this evening. Let me start off with Dr. Jyoti. Thank you for joining us again. Dr. Jyoti, let me ask you, what is going on in the big cities of Madhya Pradesh? Are we looking at a high mortality, high cases on a daily basis?
Good evening. Let me begin by telling you that definitely the situation is very grim. If it is high time that we all became aware that Corona, second wave, third wave, whatever you may call it, has come in a big way. To a large extent, I would say that we are responsible. It's high time we stop blaming the administration, the government, and it is we, the people, who should now realize that our safety is in our hands. Masks, social distancing, washing the hands again and again. These are 3 very doable things which can save us. The reason why we are getting so many serious cases, this gene of virus is different. It has been mutated. And now this virus, which is affecting us, is definitely showing a very different trend. Earlier, we used to get lung infection after 5 to 7 days. Now, the patient gets infection. On 3rd day, his lungs are already 50% infected. And by 5th day, they are 70% infected. Another thing which we are watching is that this virus is now affecting the younger age group. Earlier, we only had people with higher age group with comorbidities, but now healthy people are getting affected, their lungs are getting damaged, and they are coming to us honestly in the hospitals at, again, a very, very late stage. Because the patient thinks that let me wait for 5 days, I have nothing else, I only have fever, which comes on and off. I only have a cold and cough. So these patients wait at home, and when they report on 5th day, their lungs are already more than 50% damaged. So these are the people, these are the patients we need to watch. Yes, situation is very bad in the sense that the hospitals are full, ICUs are full. Recently, there was a shortage of certain drugs like remdesivir injection. But thanks to a very, very enlightening press conference by administration and Aurobindo chairman, Dr. Vinod Bhandari, who clarified when and where remdesivir has to be used. Also, administration now is giving remdesivir only to the hospitals. So people are not able to afford their injections.
Dr. Bindal,
and that is why...
Right. I agree with you, and that is a problem actually everywhere. In fact, some of the doctors have even indicated to us they've been under pressure to prescribe remdesivir, which has probably also led to, a big jump in this demand for it. But I am right now trying to understand what is the reality. It's grim, we agree. It's extremely serious and critical. We agree. I will not say it's the administration is not accountable or responsible. I think as much as people are for flouting the norms, it is also the administration that believed COVID had gone away. It is also the politicians who were busy campaigning. They were leading with by example by showing us visuals of rallies with thousands of lakhs of people attending it as if there is no COVID in this country, and they have sent that message to people. Why is anybody going to wear a mask when that is the message? I do agree with you. Both sides have to be accountable, not just one side. But Dr. Rakesh Pathak, good evening to you. What is the reality? When I look at the daily death figures in Madhya Pradesh, it says 18, 13, 27, 24, 24, 37. Is that the story that's reflective in the crematoriums and burial grounds?
लोग तन्वी, मध्य प्रदेश में जो हालात हैं, जो डेथ टोल की आप लोग बात कर रहे हैं, लगातार सरकार इन आंकड़ों को छुपाने की कोशिश कर रही है। भोपाल का जो शमशान घाट है और कब्रिस्तान है, वहां 2 दिन पहले हमारे एक साथी ने रिपोर्ट किया था और सरकार को चैलेंज किया था ट्विटर पर कि जो आंकड़े मैं बता रहा हूं आज पूरे दिन में जितने लोगों की अंत्येष्टि हुई है, अगर वो आंकड़ा गलत है तो मैं पत्रकारिता छोड़ दूंगा या सरकार इस्तीफा दे। सरकार के तमाम सारे प्रवक्ता उस आंकड़े को गलत नहीं ठहरा सके। तन्वी, मध्य प्रदेश सरकार की जिम्मेदारी का अनुमान आप ऐसे लगा सकते हैं कि सरकार ने आज कोरोना सलाहकार समिति बनाई है। ये एडवाइजरी कमेटी पिछली बार भी बनी थी जब 2020 में कोरोना अपने चरम पर था, और उस पिछले साल से अब तक क्या डिस्कशन हुए, क्या फैसले लिए गए, ऐसा लगता था कि सरकार ने, मध्य प्रदेश की हो चाहे केंद्र की सरकार हो, यह मान लिया था कि अब कोरोना जा चुका है। मध्य प्रदेश में बाई इलेक्शन हो रहे थे, किसी को यह चिंता नहीं थी कि जो वेंटिलेटर्स की जरूरत पड़ेगी आने वाले वक्त में, जिस तरह ऑक्सीजन की जरूरत पड़ेगी, ऑक्सीजन का आंकड़ा तन्वी आप जान लीजिए मध्य प्रदेश में क्या हालत है। आज की तारीख में ऑक्सीजन सप्लाई हमारे पास जो मध्य प्रदेश में अवेलेबिलिटी है 267 मीट्रिक टन, और जरूरत है 400 मीट्रिक टन की, 400 मीट्रिक टन की। आज स्थिति यह है कि मध्य प्रदेश सरकार छत्तीसगढ़, उड़ीसा, गुजरात, महाराष्ट्र से ऑक्सीजन मंगाने के लिए तैयार बैठी है। महाराष्ट्र से आ नहीं सकती क्योंकि महाराष्ट्र में खुद नहीं है ऑक्सीजन। हमारी सरकारों ने इस लड़ाई को इस तरह लिया कि जैसे ये एक बहुत कैजुअल चीज थी। हमने देखा था पिछली बार जब कोविड आया था तो हमने उस वक्त वेंटिलेटर एक्सपोर्ट कर दिए थे। आज हमने वैक्सीन एक्सपोर्ट कर दी और जब हमें जरूरत है तो हम अब दूसरे देशों से मांग रहे हैं। ये अजीब दौर है जहां सरकारें, जो लोक कल्याणकारी सरकार है, वेलफेयर स्टेट है, उसकी जिम्मेदारी है लोगों की जिंदगी की रक्षा करना। जी तन्वी,
तो आपने एक बहुत जो महत्वपूर्ण पॉइंट उठाया और आपने कहा कि आपके भी जर्नलिस्ट ने यही रिपोर्ट दिखाई है। सो लेट मी, बिफोर आई गो टू डॉक्टर त्रिपाठी, आई वांट टू आस्क डॉक्टर बिंदल दिस। डॉक्टर बिंदल, is this because we don't want to acknowledge the reality? Is it because there is a mismatch in what crematoriums are recording, hospitals are recording, and the government has, or because we are not counting any of the comorbidity deaths as COVID deaths? I mean, it's difficult to tell the आम आदमी कि आपको शुगर था इसलिए आपकी डेथ हो गई और आपके लव्ड वन की डेथ होगी, नहीं ना कि कोविड था इसलिए।
नहीं, मैं थोड़ा सा
डॉक्टर ज्योति जवाब दें। तन्वी के जरिए मैं आपसे पूछना चाहता हूं, ये जो कोरोना सलाहकार समिति आज एडवाइजरी कमेटी बनी है, आप तो पिछले साल भी इस पूरी चुनौती में सरकार के एक सिस्टम
तो मैं राकेश जी को करेक्ट करना चाहूंगी। जी, मैं आपको ये बताना चाहती हूँ कि इस कोविड टेक्निकल एडवाइजरी कमेटी की मीटिंग्स महीने में 3 बार 2 बार रेगुलर हो रही है पिछले पूरे साल, एंड वी हैव द रिकॉर्ड। उस कमेटी के बेसिस पे गाइडलाइंस तय हो रही है बहुत रेगुलरली।
आज तो सरकार ने आज बनी है।
ओके डॉक्टर, या उनको जवाब देने दीजिए एक बार। हाँ डॉक्टर ज्योति, आप बताएं कि क्या कमेटी में क्या प्रिपरेशन हुई और ये मिसमैच कहाँ से आ रहा है, कैसे हम मान लें कि ये डेथ फिगर?
जैसे एग्जांपल के लिए मैं बता रही हूँ कि दवाइयों की डोजेस, होम आइसोलेशन की गाइडलाइंस, स्टेप डाउन एफर्ट्स, ये सब इस एडवाइजरी कमेटी ने करे, व्हिच हैज बीन वर्किंग वेरी रेगुलरली। So that is Rakesh ji is of course one of my best friends, so I don't want to correct him, but I would like, because I was a member of technical advisory committee, I would like to state that this advisory committee has been working very diligently. Coming to the number of deaths, I have to reiterate here that administration cannot declare a death as COVID death unless we receive a COVID positive report. But yes, you're right. बहुत सारे ऐसे पेशेंट्स हैं जिनमें सिम्टम्स 100% कोविड के हैं लेकिन उनकी RT-PCR रिपोर्ट नेगेटिव है. उन डेथ्स वो भी पेशेंट्स आर डाइंग. So there is nothing like administration trying to hide. But the fact is that yes, younger age group is now succumbing. Patients without comorbidity are succumbing. And as I said, the reason is that this virus strain is affecting, it directly affects lungs straight away. So yes, and I agree with Rakesh ji, we do have a crisis of oxygen in the state, but government is really, really working hard to make sure we are seeing every day.
Dr. Jyoti Bindal, you are on the advisory committee, but I am going to ask you for just 2 seconds, keep your advisory committee hat aside and tell me honestly, Dr. Bindal, are you not feeling angry at people, at politicians who do not follow rules, who still continue to hold these large gatherings? The pressure comes on your medical fraternity.
Absolutely.
You have to handle it.
Absolutely.
Your lives are at stake right now.
Absolutely. Tanvi, if you would see, we have been working from my medical staff, my nursing staff has been working from 20th March 2020 till date. 365 days plus 20 days. These are the numbers. We all have been working non-stop without a gap. Just think of doctors, nurses, Safai Karmi, everybody, paramedics in the hospital. We are all working. Think of our tiredness level.
Yes.
And we are still going on. We have no respite. Oh, so yes, I'm very angry. We should not hold big meetings. You talk of political rallies, I talk of weddings. लोगों को समझ ही नहीं आता है, बड़े धूमधाम से शादियां कर रहे हैं, बारातें निकाल रहे हैं बिना मास्क के, घरों में खाने हो रहे हैं, फ्यूनरल्स हो रहे हैं, रिलीजियस सारे फंक्शन हो रहे हैं. So somewhere, unless we as public wake up, I mean, we should be the people. I mean, at least I must be telling, at least रास्ते में गाड़ी रोक के मैं लोगों को कहती हूँ, क्यों खड़े हो, बिना मास्क के क्यों खड़े हो, that kind of thing.
So I think you should, but you should, in your next conversation, even with the leaders, tell them that they need to step up on this as well. लोग तो तभी सुनेंगे जब वो सरकारें उनको मना करेंगी. अगर सरकारें जाके बोलेंगे आ जाओ कुंभ मेले में शाही स्नान हमने ऑर्गेनाइज किया है, तो हजारों की तादाद में पहुंच जाएंगे वो वहां पे, फिर कोई उनकी रिपोर्ट देखे ना देखे. डॉक्टर त्रिपाठी, थैंक यू फॉर जॉइनिंग अस. डॉक्टर त्रिपाठी, is this problem about data mismatch taking place not because governments don't want to admit the reality, but because it is convenient to hide behind the guideline कि comorbidity है तो count ना करें इसको?
No. Actually, as Madam has already mentioned, if the PCR test report is positive, whether it's a comorbidity case or without comorbidity, it has to be labeled as a death due to COVID. You cannot hide. How can you hide? There's always recording at the crematory site also how many dead bodies they have been cremated, and since morning and since last 24 hours, how many by this routine funeral, how many by this electric cremation. Everything is being recorded. And whenever there is a certificate, death certificate, that also mention whether this is the COVID positive case, means diabetes mellitus with heart disease with COVID positive, or this is simply diabetes with heart attack. So you cannot hide. How can you hide? I don't know.
So that's what but it is being done. I am looking at data, cumulative COVID death count released by Uttar Pradesh government, 124 COVID deaths in 7 days. I am looking at data from crematoriums that adds up to 400 from crematoriums, COVID death data, not all deaths or bodies that they may have cremated. On April 13, government said 18 people died, but 86 bodies were cremated. On April 12th, 86 bodies were cremated again. Official figure was 21. So then why is this happening?
Actually, government is having a record of mortality in their hospitals. There are a lot of people who are dying without going to the hospital. Because in last 2 weeks, Now Uttar Pradesh, now Lucknow, I'm working in a largest hospital of the Asia. What to talk of Uttar Pradesh or India? It is the 4,500 bedded hospital, and we have 500 bedded COVID hospital separately with 200 ICU beds. And other than this, the people, they are managing their patients at home. They are managing at simple small nursing homes. And what to do? So I think the patient going directly, they are dying. Some private setup and going directly, probably that may be the reason. That may be the mismatch. But ultimately, the death is death. And of course, every death as a COVID death has to be counted. I think probably this may be the reason of the mismatch.
But are you getting more serious cases? Is there a change in trend we are witnessing in state after state, that the cases that are coming to you are more serious now?
Yes. Now I would say that very versatile virus. Very versatile virus. As Madam mentioned, this was the story in 2020, that virus going inside the nose. For first 2 days, it will remain in the nose. For next 2 days in the throat, and then it will reach to the lung. And depending upon the immunity, it can cause pneumonia, it can cause ARDS, or multi-organ involvement and multi-organ failure, or it may not cause it. So basically, it was immunity dependent. But now the presentations are variable. I can tell you, a few days back, my two of the junior doctors, they were having symptoms of conjunctivitis. And probably I read somewhere that conjunctivitis can be a presentation of COVID-19. I asked them, they get tested. They said, sir, I'm having a little bit itching in the eye. Why should I get tested for the COVID? And then on my advice, they get tested, and ultimately next day they found positive. Simply people having only backache, only body ache. So now the symptoms are versatile from top to bottom, any symptom. Now I'm saying any symptom can be a COVID symptom. Last year, if you check my video channels, YouTube channel, then I say very famous video कि जैसे हर चमकती चीज सोना नहीं होती, वैसे हर टपकती नाक कोरोना नहीं होती. Now I am saying हर चमकती चीज सोना होती है और हर लक्षण कोरोना होता है. So that kind of the versatile, the variable symptoms we are observing this time.
No, you're absolutely right. And in fact, two issues that both of you have raised here, one about different symptoms, and the other issue that we will also be talking about is whether COVID RT-PCR tests are actually working the same way as they were the last time around. But all of these are different issues and must be addressed. I want to, so my apologies, I am completely out of time, Dr. Jyoti. 30 seconds to you though, because you wanted to make a point. Yes.
Yeah, I wanted to say that right now I'm working as a Vice Chancellor in Sri Aurobindo Hospital. Now, this is the biggest hospital in the private sector in Indore, and we have 250 ICU beds, which are all full. We have total 1,100 COVID beds dedicated, which are all full. But I'm telling you, the number of deaths in each hospital, we are aware of it. Many of these deaths are non-COVID deaths. They may have symptoms. So it's not that administration is hiding. Administration has to be 100% sure that they were COVID positive patients before they release the number.
I am assuming that the crematoriums also do that. They, in most cases, they even get bodies. These are the reports that have come, at least from Gujarat, where the bodies have come wrapped in the COVID protocol, as per the COVID protocol, with the certificates in place. And that's why they've been registered as COVID deaths.
No, Tanvi, the guidelines are that every death has to be considered, has to be cremated as a COVID death.
Without really giving a certificate for it?
Every death has to be cremated in the COVID times with all the protocols which you would give to a COVID patient.
Yeah, but you don't put it in your records as a COVID death, do you, at the crematorium? At the crematorium, when they put it in the records, Dr. Bindal, they will not say it's a COVID death unless they have the certificate and the COVID test certificate.
No, that's true. That's true, 100%.
Okay. All right. This will continue and we will keep a very close eye. Thank you to our panelists for joining us. We are out of time. But viewers, states need to relook at the policy in which they are recording. And I'll give you another example. Even in Chhattisgarh, we are seeing mortuaries completely flooded, bodies piling up. And they are also saying that all of these bodies which are waiting for to be cremated are COVID bodies. Work is now being done round the clock to clear the backlog, to clear the queue. Government is saying they're adding additional electric crematoriums to ease the burden. These are the examples and indicators that show you just how bad the situation is. And my attempt is not to scare you or alarm you, but to make you aware that this is a deadly infection and our healthcare systems are overwhelmed and crumbling. And so we need to do our part, lest we become one of those who have to undergo this unfortunate nightmare of an experience. Thank you for joining us.